Hello everyone, welcome to my channel Cancer Doctor Studio. Let us all educate about cervical cancer vaccine dose and number of doses to be taken. So let's start the awareness. Cervical cancer is a growth of cells that starts in the cervix. The cervix is lower part of the uterus that connects to the uppermost part of the vagina. What are the risk factors for the cervical cancer? The most common risk factor for development of cervical cancer is human papilloma virus infection. That is, persistent human papilloma virus infection will lead to the development of cervical cancer. The other various causes includes early marriage, sexually active at younger age, having multiple sexual partners, poor genital hygiene, smoking, multiple pregnancies, and low immunity and use of oral contraceptive pills also can cause cervical cancer. Now, let us talk about human papilloma virus. The most common cause human papilloma virus in the development of cervical cancer. The various studies estimates that more than 90% of cervical cancer are related to the presence of human papilloma virus, and these infections contracted via sexual intercourse. Clinically, HPV subtypes are classified as high risk HPV subtypes and low risk HPV subtypes based upon their cervical cancer oncogenicity. High-risk subtypes include HPV-16 and HPV-18, HPV-31, 33, and 45. Of these, most common are HPV-16 and 18, which are found approximately in 70% of cervical cancers. HPV-6 and 11 are low-risk subtypes. Although high prevalence of HPV exists worldwide, peaking at the age of 25 to 35 years, only less than 15% of exposed women develop persistent infection that results in dysplasia and invasive cervical cancer, whereas the majority of women clear the infection within 2 years. Cervical cancer may develop 10 to 20 years after initial exposure to HPV infection. Coming to the vaccination schedule, the US Food and Drug Administration has approved 3 vaccines that prevent HPV infection and subsequent development of cervical cancer. Bivalent vaccine and quadrivalent vaccines are available in India. Bivalent vaccine famous is Cervarix and quadrivalent famous is Gardasil. The bivalent, it has two HPV strains, antibodies, HPV-16 and HPV-18, which are the most common serotype causing HPV infection and development of cervical cancer. The 1 month between the doses 1 and 2 and 6 months between doses 1 and 3. So it will be a 0-1-6 schedule. Whereas quadrivalent, it is 2 months between gap between doses 1 and 2 and 6 month gap between doses 1 and 3. So it will be 0, 2 and 6 month schedule. These vaccines should be administered intramuscularly in the deltoid region of the upper arm or in the higher anterolateral area of the thigh. The preferred site for administration is the deltoid region of the right or left arm, upper arm. Coming to the vaccine efficacy or safety, Gardasil, which is a quadrivalent vaccine, has 98% efficacy in preventing cervical precancers caused by HPV-16 and 18, and it has shown 100% efficacy in preventing vulvar and vaginal precancers, genital warts caused by HPV strains 6, 11, 16, and 18. We all can end cervical cancer. Let's get vaccinated with HPV vaccination. It is safe and protects women from the cervical cancer. Get informed, get screened, and get vaccinated. Please take your vaccination shot if not taken yet. For more awareness videos about cervical cancer, please follow my page at Cancer Doctor Studio. Thank you all. Please follow, share, subscribe Cancer Doctor Studio. Thank you for your support.